Hi, I'm Nick Pyle, Chief Exec of the Society of Occupational Medicine. I'm introducing some occupational health technicians, a nurse, a doctor, a psychologist and a physiotherapist who are going to talk about why occupational health is such a great career.
So I started my career in the NHS working as a junior completing rotations and then chose to specialise in musculoskeletal. I then worked in outpatients as a senior member of staff, developing my clinical skills and supervising juniors.
So I did my undergraduate degree in psychology and initially was working towards becoming a clinical psychologist.
I started out training as a midwife, but with 3 young children of my own, I decided that I wanted to work in a health-related field, but something that involved regular hours and to have more of a work-life balance.
I started out in medicine, qualifying from Glasgow University and then training as a GP up in the Highlands. After that I joined the military and that's where I first became aware of occupational medicine as a specialty.
I trained as a nurse in Edinburgh and started my career in occupational health nursing after working as a school nurse in London.
I moved towards occupational health psychology because I felt most of us spend a lot of our time in and around work, and that if we can develop psychologically healthier workplaces, this will allow us to prevent and better manage mental health in the workplace and society in general.
By spending some time understanding the issues in the workplace, I was able to really find a way of improving people's health and getting higher performance. The challenges around occupational health and understanding the barriers to particular areas in performance is really fascinating in different work environments and is a key part of the reason why I wanted to study occupational medicine further.
I was first attracted to occupational health after talking to a couple of colleagues who I used to work with. They explained kind of the different environments that I'd be working in and the fact that every day was different. That excited me because I thought it'd be a new challenge, I'd be able to gain new clinical skills and also gain a bit more of a work-life balance. 15
years ago I set up my own OH provider company to have more control over my work-life balance. Every day is different and I've learnt so much and continue to learn. I now have over 100 different clients and have a fantastic team working with me. I'm still passionate about delivering occupational health to both employer and employee.
So when I first joined Connect Health, I underwent a training programme on the job, followed some of the more senior members of staff working inside the factories, inside the areas in which we work, watching them treat patients acutely, completing workplace assessments and working closely with occupational health nurses as well as management.
The specialist training programme involves rotation around all the competencies, which can be as varied as looking at the different exposures people have in the workplace. There's a lot around industry medicine, toxicology, hygiene, and what was really interesting was actually spending time in people's workplaces and understanding the potential health hazards.
Keen to learn more about the relationship between health and work, I completed a full-time occupational health nursing certificate course in Manchester.
A variety of external training courses to help get me qualified as an occupational health and wellbeing technician.
So what I do is I look at the relationship between working conditions on employee health. This includes work-related stress, burnout, how we translate research findings into practice, and this involves a number of projects such as managing work-related stress in SMEs, developing resilience among firefighters, and influencing mental health policies at a European level.
I've had numerous jobs in occupational health since completing my course, all very varied and allowing me to fit my work around my family needs. The areas I've worked in include brewing, BBC North and South, distribution logistics, the healthcare sector, banking and the Environment Agency. I also completed further studying at Bristol University looking at the effects of shift work.
I'm currently the Managing Director of a social enterprise with my husband, who's also a consultant occupational physician. The social enterprise works with companies and local government in trying to change the focus of employees with a disability to looking at their ability to take down barriers in the workplace and to try and get as many people with a disability accessing work. Part of that is traditional occupational medicine, where we do case management, and some of it is a more novel approach around training businesses at how they can put adjustments in for people with long-term disability.
Currently I work within the Northwest, working in a variety of companies and areas, including transport and manufacturing. I treat on a daily basis within the area itself, linking with the managers and HR, talking about absence and any way in which we can support the employee on the job. This also allows me to complete workplace assessments and see if there's anything we can do to either help or reduce the risk of injury for employees themselves.
I thoroughly enjoy what I do. It's very rewarding, and it means that I get to work with people throughout the whole of the organisation because I'm field based, and I'm really motivated by helping people make a difference and be healthy within the workplace.
So I hope you enjoyed all these occupational health professionals talking about what a great career occupational health is. If you want to find out more, do contact us or go online at www.som.org.uk. Thanks.